I'm here tonight to speak with Beth Molenbrock and Rebecca O'Neill, two of the founding members of the new startup company, Mobile Medical Records. How are you two tonight?
Fine, thank you.
My real purpose tonight is to focus on how the startup company began. But before we get into that, what is MMR and emergency MMR?
The MMR is a secure 16 gigabyte USB flash drive. It has all-inclusive healthcare and legal records management software on it. And the emergency MMR is a small version of that. It doesn't have the security. It's designed to be used for medical emergencies.
Aren't there products like that already on the market?
No, there really aren't any products that offer the combination of hardware and software that our product offers. The MMR is ultra secure from hackers because the user keys their PIN number right on the keypad. They don't use their keyboard on their computer for that. When the device is removed from the computer, it automatically locks. So if this were to be stolen, you cannot get the data off of it. So it makes it highly, highly secure. One of the most secure USB flash drives in the world. Also, the software that we have built and put onto this flash drive is very easy to use. There's no special software that has to be loaded onto a computer.
My understanding that there are three people who founded Mobile Medical Records. You, Beth, an information management and technology specialist, Rebecca, an attorney and a law professor, and Hiram Dahmer, who has worked in international security for most of his career. How did you three accomplished professionals come together to form Mobile Medical Records?
So Becky called me up one night about 2 years ago and said she had just attended a legal conference, and that conference was talking about health records. And she had an idea that she wanted to talk to me about. So she came over and she explained to me that medical providers will be converting their medical records into digital format. And this created a need for patients to be able to conveniently and safely store their medical records. So Becky and Hiram had been corresponding about this. Hiram was out of the country. And they proposed that the three of us team up and create a company, which ultimately became Mobile Medical Records. We brainstormed about what we believed would be a best solution for this need. We talked about things like the storage device being portable, being durable, being secure, being easy to use, being not requiring any software from any other computers. And anyhow, so Becky asked me to lead a team to accomplish creating that type of solution.
So, as Beth always does, she accomplished creating the device, and not only creating the device and the software that we have on it, but creating what we believe is the most secure medical storage device for patients in the entire world.
Well, how did you accomplish this, Beth?
Well, my entire professional career has been focused on information management, collecting information, storing it, and ultimately making it into a usable format. With anything in life, if people have the right information at the right time, you can make better decisions, you can get better outcomes. So it was an exciting challenge when Becky thought of the idea. It was really right down my alley. And throughout my career, I've worked with many, many talented individuals. So I was lucky enough to be able to pull a team together. We had a programmer, a graphic artist, a web interface specialist, an attorney, our family, our children, my son-in-law, and really uncanny the complementing skills that everyone brought to the project. And we had a lot of fun doing it, and so ultimately we came out with our two products.
Rebecca, you mentioned that medical providers will be converting records to digital records. What made you believe that patients also need a storage place for these records? Can't patients access their records by patient portals that doctors provide access to over the internet?
Well, it depends. Many doctors are going that route as a way of communicating the electronic health records to the patients. They're creating patient portals. For example, I have 3 doctors that I see for various medical problems, and they have patient portals. But I've been to my patient portals, and the problem with the patient portals right now is that they are not accurate. They are severely lacking in my medical records. I would tell you that probably about 1% of my medical information is in my patient portals. And that's a problem. It's a problem for my doctors. It's a problem for me, because none of them see a clear picture of my history, my tests, none of them have a clear picture of my health without all of the information being on there. And let me explain my perspective as a parent. We had 3 children, and each of our children had pyloric spasms when they were infants. And our youngest son, I took him to the doctor, and she prescribed a muscle relaxant. And I've got the prescription filled. I went home, got it, and during the night that night, he was having pyloric spasms, crying. And I went to the medicine cabinet, and I pulled out the medicine, and I looked at the bottle, and I realized that the prescription was different than what the doctor had told me about in the appointment. She had told me the dosage, and I noticed that the dosage on this wasn't the same. So I started thinking, well, maybe this is a generic drug, so maybe that would be the reason that the dosage is different. So I debated, should I give it to him to help ease his pain, or should we just make it through the night and wait and call the doctor in the morning to see what I really should do? And I erred on the side of waiting and not giving him the medication. So the next day I called the doctor and told the doctor my concern about the prescription dosage being different than what she had explained to me in her office. And she literally gasped. And she told me that if I had given my baby the dosage that was on the bottle, it would have killed him. Well, you can imagine how that made me feel, that I almost killed my son that night. So anyway, I called the pharmacist and I said, you've got the wrong dosage on this. And the doctor told me it would have killed my child if I had given it to him. And the pharmacist said to me, I couldn't read the doctor's handwriting. And besides that, it wouldn't have killed your son anyway. Well, you know what? That wasn't a good enough answer for me. And my goal is that there won't ever be an excuse in the future that a pharmacist could not read somebody's handwriting, because we will have the prescription in electronic format and everybody will know what that number is. And let me give you my perspective as a care manager. I am the care manager for my cousin who's elderly, and she has had cancer for 3 years. And I'm also her power of attorney, her agent on her power of attorney for health care. During these past 3 years, she's been to the doctors, many times. She has boxes and boxes of medical records. And complementing that, she has boxes and boxes of medical bills and insurance claims. And a large part of my managing her care is keeping on top of all of that. So when she goes to the hospital, I need to know what her medication is. When the bill comes in, I need to know whether it's been billed properly to the right insurance company, whether the claims have been submitted properly, whether it's been processed properly. I literally have 4 or 5 banker boxes full of all her records. 3 years ago, if I had started with this, it would all be right here on this device. When she's in long-term care now, she's in hospice, she's dying. And when the people from the nursing home take her by ambulance to the doctor, they bring in her medical records that the nursing home has. You know what it is? It's a big book, and it's at least that thick. Now you can imagine how hard it is for that doctor to find something in that book. If she just had her medical records on this, it would be so much easier. And then let me tell you about my perspective as an attorney. I've been an attorney for more than 25 years, and most of my practice has been as an attorney in a legal clinic and a law school, teaching law students how to practice law by providing free legal services to the elderly. And as you can imagine, a large part of my practice is the intersection of healthcare, medical care, and the law, because I give advice to clients daily on power of attorneys, living wills, guardianships for those people who never completed those types of documents. And I also do a lot of trainings for hospitals and doctors so that they understand the surrogate decision-making process. A large part of medical care is understanding what the patient wants, and many people express that in their legal documents. Those legal documents can be stored on this. So that intersection of legal records and medical records is here. People need that because it's such an important and integral part of their health care.
I see that. Beth, who do you see as the market for these devices?
Well, you heard Becky say earlier that the world is our oyster. We feel like the world is our market. You heard the stories that Becky shared, and many people have similar kinds of situations in their lives, people that they're taking care of, loved ones. So we feel like anyone can benefit from having their family health history, their medical, their optical, their dental, the legal records, all accessible, all secure, all available. Really, new parents should start storing their newborns' records immediately. Their health history should follow the patient through their entire life.
Well, what do you see as the future for MMR?
Well, we hope to make a big difference. We hope that our products make a big difference in people's lives. The MMR will help people be at their best level of health through accurate information and through mindfulness of their health. We feel like what is real central to what we're offering is that it's patient-centric. Our slogan is, "Your health belongs in your hands." We believe that, and we think that this product literally provides that opportunity for people to be mindful and to manage their own health. We think that the emergency MMR will literally save lives. The device would never replace the doctor, but it would really help a doctor to have complete, up-to-date, accurate, thorough information. Better decisions will be made, better outcomes will happen. We think it will reduce errors. It will improve the continuity of care. It will enhance the patient education. It'll improve the patient-provider satisfaction. So we really want people to be at their best level of health.
Well, congratulations. It seems like mobile medical records is a great product that has potential to greatly improve the quality of people's health care and provide them with the ability to engage in their own health care decisions. So congratulations and good luck.
Well,
Thank
thank
you.
you.